one other thing I wanted to mention that I was so happy that my senior specialist was able to bring this to my attention while I was homesick. Maybe after the first week, I think it came up, was the challenge that the team was having with coming to work every day on multiple levels. You know, living in New York City, almost all of them live in Manhattan and work in the Bronx. For those of you that aren't from this area that don't know what that means usually about an hour subway ride from one point to the next to get to where you're going. We live in the very northern part of New York City, at the top of the Bronx is where our hospital is, rather. And many of them live in the heart of Manhattan. So between changing lines and, you know, up and down and walking blocks and whatever, most of them have about an hour commute on a very crowded subway train with a lot of other people. They were fearful about being on the trains. They were fearful about being out in the street. They were concerned about catching something and bringing it here to compromise children or staff members. They were concerned about bringing things home to their family, you know. So we quickly, they had a meeting without me because I was too sick to even participate. They had a meeting and they talked about ideas and they really brainstormed together, you know, what will be the best plan for our team to feel supported, not overwhelmed, but still provide the level of patient care that we need. And they came up with a couple of different ideas, and then they presented them to me while I was at home. And my senior specialist made her recommendation to me based on what she had witnessed. And we came up with a plan for altering our schedules a little bit to make people feel more comfortable. We had one staff member who had work from home note from her doctor. So she was working from home. And she's been very productive, getting a lot of projects done for us while she's been working from home. And then everybody else went into a 4-day-a-week schedule with a 1-day work from home. And they organized a task list of projects and things that we've been wanting to complete that you never have time to because you're so clinical duties. And it was sort of left up to the individual. There was a few projects in the very beginning we wanted to get done that were COVID specific. Some resources and materials that we wanted to get organized and things that they wanted to produce themselves. Those were the first things they did. And then after that, it was sort of left up to the individual to go into our iDrive, look at the projects available, choose something that you need to work on or that you want to work on, and use that as your time at home to work. And we did some altering of schedules so that people could maybe come in a little later and leave a little later, or come in earlier and leave earlier to avoid rush hour on the train, which in New York has not been its typical rush hour. It hasn't been as crowded. But
still crowded. I've seen,
And there was also a phenomenon of some of my staff saying, you know, now that there wasn't as many people, they felt like more of a target for people on the street who maybe weren't that concerned with wearing a mask or being sanitary. So we were able to be flexible about the schedule, and it's really helped people. And the first week that we did it, I took more feedback from them and said, how did this work? Do you feel better? Do you feel supported? Are you feeling less overwhelmed? Some of them said, I feel great. It's exactly what I want to do. I'm going to keep doing it. Others of them said, actually, I feel more nervous being at home. I'd rather be here. You know, there were a variety of feedback that we got. And so we settled into being flexible enough to say, choose whichever way is going to work for you. Our goal is that you can come to work and not feel stressed out. We had a couple of other things that happened at our institution specifically that were so helpful. One being free meals all the time. So all day long you can get free meals. They also offered free parking. So all day, you know, every day you could get free parking. Locally, Hertz Rent-A-Car gave free rentals for the whole month to anybody in healthcare. So several of my staff were able to get free rental cars and then drive to work and not have to use the subways at all and park in the garage. So that was great. And then the other thing they did was they afforded all of us 10 COVID sick days during this time that will not be charged to any accrual bank. So you don't have to feel concerned about being out. Like, I don't have enough time in my bank, or I'm not going to get paid, or I'm going to use up all my time and never be able to take a day off for the rest of the year. They wanted to put that worry out of everybody's mind. So this way, if you needed to take 10 days out of a 2-week period off because you're sick, stay home and fully recover. You know, I've told all of my staff, stay home until you feel fully recovered. You know, don't feel like you have to rush back because, you know, you really want to feel 100%.
Do you have a sense at all, and this sounds like a silly question and probably is, of any kind of normalcy? I mean, it's a different type of normalcy, but I can't imagine. I would only think that on those first initial days of feeling like myself, like the symptom free, I would be suspicious, like a little skeptical that I was truly healthy. Or, I mean, it must just be like a PTSD.
Yes. I definitely felt that way. I felt that way while I was still home. And then in fact, I did have a little setback and I said, oh, see, I knew it.
Yeah.
And then when I came back, the last week that I was home, the other thing that happened that I hadn't expected was a lot of my loved ones, friends and family, were really angry at me for the thought of going back to work. And they were aggressive with me about it. You know, you can't go back to work. You need to stay home. What if you get re-exposed? And, you know, people were cussing me out. And I was like, I'm a healthcare professional.
Right.
This is what I do.
Yeah.
I was feeling guilty about not being at work. I was feeling, you know, guilty about going back to work and letting down people who love me and don't want me to be, you know, exposed. Or thought that maybe I wasn't strong enough, you know, and I had to really go within myself and know myself and say, I know that I'm going to make the right decision. I'm going to make a smart decision. I'm going to make an ethical decision. I'm going to go back when I know that it's safe and healthy for me to go back.
Right.
And I did, you know, and then coming back and seeing, you know, as I said, you know, different people that are no longer here, that you weren't expecting that. You know, the unit secretary that's worked here for 20 years and she passed away. The guy from the pizza place down the street where we get our pizza every Friday and he's passed away, you know, and you just start to hear. And then when I came back and spoke to other colleagues who also had it around the same time, you know, because we all had it during those 3-4 weeks that it was the most intense. And speaking to them and hearing that their course was so similar to mine, some shorter, some longer. And thank God that, you know, we didn't go to the point of hospitalization and ventilation. But hearing so many stories that were similar was both validating, but also scary. Like how many people this happened to. I had the colleague that took my temperature that day. She went out a couple of weeks after me. Now, whether she got it from me or on her unit, or, you know, because other people in her unit also went out at the same time and there was patient exposure on her unit, it's unclear, you know, but I had a lot of guilt over that. Like I could, and she's older than I am, in her 60s. And I was concerned that she could have gotten more ill. And she came back and the first day that we talked, she pulled me aside and she said, and this is someone who's been a nurse for like 45 years. She's tough and she's seen it all and she's done it all. And she's a great, great nurse leader. And she pulled me aside and she said, was there ever a time when you were home that you really thought you might die? And I said, yes.
Yeah.
And she said, me too.
Yeah.
And like, that was it. It was just like, we needed to validate that we had got to that point.
Yeah.
You know, and then pulled out of it.
Right.
And I'm so grateful to my Child Life peeps because, you know, my Child Life community rallied and people texted me and posted and commented and sent me well wishes and prayers and, you know, really rallied around me. And I appreciate that so much.
It's an amazing story and experience. And it feels so superficial for me to even find a term to describe what you just shared. It highlights for me the need to provide space and time for the world, but especially the survivors and the providers and all the caregivers that are taking care of patients to have time to process through everything that they're seeing and having to go through, either, you know, process with each other, but also have time within their own reflection to realize that, it's existential. You're faced with existential anxiety, you know, your professional role, what it all means. I think the saddest thing that I think we're all obviously realizing is, yes, that people are dying alone. I mean, that everyone is doing their best to allow for some semblance of connection.
Yeah.
For those final moments. But how lonely and terrifying that is if that's happening, because you just never actually feel like that's something that, unless you are forced to have to go through, no one should have to die alone. But that's exactly what is happening right now.
Yeah. I was saying to someone earlier today, I think that people's stories about their COVID experience, it makes me reflect on, when we were learning about death and dying and what happens in grief for people and loss. And oftentimes when someone loses a loved one, they need to tell the story of that loss, dozens of times before they process it and feel like they're making any headway in healing from it. And obviously there's a large group of people who are processing that real grief of losing somebody in their life and having to tell that story over and over. And what was that like to not be able to be with them? What is it like to not be able to bury them yet?
Yeah.
You have to think about how you're going to bury them in the future. And then there's another layer of people like myself who were sick with it and recovered and tell our stories to feel validated, to feel seen and heard, to feel like this really happened to me, because it happened to me alone. Nobody else witnessed it because I live alone and I was home alone. And so to get that validation is important to understand, like, this is my story. This is part of my story. And I've had other illnesses in my life and I've told those stories too. But it's part of my own, fabric that I'm moving as I move along. And I think the next layer is going to be all those that bore witness to it.
Absolutely.
And, the frontline workers, the family members, the essential, employees of our world. As time goes on, I keep thinking that in a month, maybe or so, things will start to settle down and be a little more quiet. And people that are in the middle of those battles of that war right now are going to have a moment to take a breath. And when they take a breath, they're going to realize what they just witnessed.
Right.
And that PTSD that you referred to is going to come in a huge wave.
Absolutely.
And I think our community needs to be aware that we might get called upon to address that, but we also need to address it for ourselves.
Right.
And so I think it's important that we reach out to all of our disciplinary partners, nursing, social work, physicians, any kind of, discipline that we come in contact with, and figure out ahead of time, what are we going to do for this?
Yes.
How are we going to address this? Because we all went through it.
Right.
There's not somebody else somewhere else that can come in as an outside consultant and say, let me help you with this, because everybody's going through it.
Absolutely.
So we have to figure out a way together that we can come up with a system for how we're going to process this.
Yeah.
What we're going to do to address the mental health issues that are going to come out over the next couple of months. And then what's going to happen if there's another wave?
Yes.
How are we going to be prepared for that? And earlier today also, I was speaking with my creative arts therapy team about, virtual programming and just really thinking about all of our programs, taking a pause, taking a breath, stepping back and thinking about, there's a whole shift in the world now. The world is a different place.
Yeah, absolutely.
So we need to start thinking differently about how we offer our programming. And where's the equity in that? There are some hospitals that have a lot of money and funding and other hospitals that don't.
Yeah.
So how can we offer the same level of quality programming everywhere? What do we do about our interns and practicum students? What do we do about our community partners that come in and provide us entertainment and great programming? What do we do about our volunteer programs? All of these things are getting impacted.
Yeah.
And I think it would benefit us to give ourselves a little break and say, I'm going to pause. I'm going to recover from this traumatic experience.
Right.
And while I'm doing that, I'm going to develop a new way to run our programs. And maybe, look at the model. I mean, I can't speak to other parts of the country, but in New York City, there really became this sense of oneness about the healthcare industry.
Mm-hmm.
New York City has a lot of competitive hospital systems, but our governor brought us together and said, everybody needs to share supplies, ideas, resources, personnel needs to all come together.
Yeah.
And I feel like Child Life has always been that kind of community.
Right.
In New York, we have Child Life of Greater New York Association. We all share ideas. We all work together for resources. We all try to help each other. We go to each other's fundraisers. We really are a community like that. And hopefully that can spill over into the entire healthcare industry.
Absolutely. Yeah. Everything you just said is exactly the momentum we want to take, right? It's not enough to just physically survive through this pandemic and hope that the restrictions lift and that life goes back to normal, because it won't. But we now have to begin these conversations about exactly what Child Life Specialist does, which are building resiliency, coping, processing, so that we can then continue helping ourselves, continue helping others. So how do we get in on those conversations, and how do we begin helping people through not only the acute moment of stress and anxiety, but now having the tools to kind of lift yourself up and carry on. But as you pointed out, I think before all that can happen, we do need that moment of ability to just listen and sit with one another and share these stories, so that we can begin unpacking whatever needs to be unpacked to free up the mental and emotional space to begin being creative and innovative around what we need to do next. And so I just say all that to say we're looking forward to those moments. And I am confident you will share and be a contributor to those conversations about the role of Child Life and the ways in which it will morph because of these current situations. But I think for the time being, I'm afraid if I just keep talking, I will dilute the power of your voice and your story, because it's an amazing memory, I think, to just hear of and be a part of, just by hearing your repeating it to us. And I can't wait to see you in person and give you a hug without social distancing.
I know. I truly appreciate your giving me the opportunity for this testimony.
Always.
And also your leadership of ACLP during this time has been so challenging, and you've handled it with grace and smart decisions. And I appreciate your personal outreach to me when you knew that I was sick and needed some support. So thank you for all of that.
Of course. Well, it's only to give highlight and admiration to you and your colleagues. It's the humble heroes of the hospitals. And I know that there's kind of controversy over that word heroes, but that is exactly what you all are doing. At moments like these, when everyone else is told, go home, shut in, stay safe, and yet our members are still showing up, standing firm. And, it's inspirational and courageous. So I thank you for being a part of that, and for sharing part of your day with me today. We're going to post this, so I'm sure you'll get a ton of questions, comments, support, as always, from our community. But for the time being, I'm going to give you my own personal thanks and admiration fully. So thank you, Meghan.
Thank you, Jen.